All right, welcome back, everybody. We're here live again for our next interview here at 11 o'clock. And there's my face. The first thing I want to do is make sure that you're all getting the information that you need to enter our contest. Remember that I posted it on the Facebook page that you can go to that link and sign up and get ready for some prizes that we're going to give away. You can also like, share, and comment on the video. Before I get to our guest, I am going to recognize our sponsors for today. So just bear with me for a second. Sunshine Cafe, O'Reilly's Auto Parts, Mattress Firm, Sherwin-Williams, American Rental, Nature's Nook, Bob Evans, O'Charlie's, BW3's, 40 Bowl, Johnson Chiropractic, Studebaker Buick, Lux Lizzie's, Olive Garden, Chili's, Jimmy John's, Texas Roadhouse, Journey Yoga Studios, Therapeutic Solutions, and El Rodeo Restaurant. So we've got a bunch of stuff to give away. And if you're not on the contest yet, you need to get on. So make sure you share this video with other people so lots of people can get signed up, and we'll do the drawings later today in another live video. Now, with that having been said and everybody's set, is Dr. Sorcha Cox. She is a home health physical therapist. Most of you may know her because she actually used to work for us for a while. But we're going to bring her in to talk a little bit about home health physical therapy, who may benefit from that, get you a little bit to know her a little bit better. And then we're also going to talk about student loan debt and the student loan debacle and crisis that's going on right now. It is a real thing. If you haven't been involved in it, it is a real thing. So let's pull Sorcha into our discussion here and get rid of that.
Hi.
Hi. Let's make you equal. There you go. So obviously she's coming live to us from her car because she is a home health physical therapist. How you doing, Sorcha?
I'm good. It's nice and snowy out here.
Yeah, it's been a little dangerous today, hasn't it?
Yeah, it's been a little rough.
Tell everybody what happened just the other day.
Well, I was on my way to a rural home and my car didn't make it out of their drive. So I went into a ditch and they had to pull me out with their truck and a rope.
Well, at least somebody was there to help you.
Yeah, that's true. I waited a while, but eventually, yes.
I think you need to start a diary about the things that happen to home health therapists. Because
I've actually thought about that. There's a lot of stuff.
It'll be humorous. Hey, so obviously I know you well because we've known each other for about 3 years. But why don't you give everybody a sense of, why are you in Richmond? Where are you from? Because a lot of people might not know you. So why don't you give just a little bit of background?
Yeah. So I went to Hagerstown High School, played a lot of sports there. So that's probably how a lot of people recognize my name. And then I went to Anderson University, played college ball there for I was a softball player. We had a lot of success there. So and just because my name is weird, a lot of people recognize it from those things. And then
Hey, you just shut off your audio.
Since I lived in Fort Wayne for grad school, I was just kind of wanted to come back home after that long 7 years of my life. And so I came back and I've been in Richmond living ever since.
Awesome. And tell us a little bit about physical therapy school, how long that is now, so people know how much training you've had after an undergraduate degree.
Yeah, so after the undergrad, which is 4 years, you have to go for 3 more years. Then you have to take a board exam. And so it's technically a doctorate, and I do that because it is a doctorate, but it's not like you're a medical doctor. That's just what they upped it to. So yes, there is an extra year of school from what it used to be, and it is more expensive. So we're very proficient in what we do. It's a lot of musculoskeletal, like bones and joints issues, and that's our specialty. So
sure. So you're in home health now, and give us a little bit of a sense of what a day in home health is like for a physical therapist.
Well, oh gosh, it depends on the day. Like today, it looks like this with lots of snow and lots of driving, especially in a rural area. I cover like 7 counties or something like that. And
what would be the normal? You would drive how many miles per day?
Lately, it's been like 70 to 90. Hasn't been as crazy, but
it's been up to 150.
Yeah,
that's a long drive.
Yeah, a lot. But a
Tell
normal day
me,
would look like lots of driving. You do patient evaluations in their home. It's different because you have to get all their equipment. You don't have your clinic. You got to get oriented every single place you go. It's a lot different.
tell me some of these roadblocks or some of the things that are difficult in home care that us outpatient therapists don't have to deal with.
It depends on your agency. And hi, Linda. She said hi.
Yep.
So sometimes the PT can't go do their evaluation until after the nurse is done. That's something that I didn't know. And that can be, you kind of have to schedule around that sometimes. Weather is a factor, tires going out, traffic, lots of stuff that just you're mobile. You're not in your own place. You're not comfortable. And patients, usually everyone's got a pretty cleanly home, but you never know what you'll walk into. So that's another thing.
Is there something that you learned about Wayne County or the counties that you have serviced that you maybe didn't know a year ago?
There are a lot of nice houses out there in the area. I'm not kidding. Like, I just never really looked because I'm from the area and I'm like, oh, whatever. But if you really look, there are a lot of nice houses and there's great people everywhere. Everyone's usually very helpful. The patients want to do their best for you. They try to accommodate you. So everyone's just friendly because it's rural, you know.
Gotcha. Have you noticed consistent problems in homes that people should be aware about that we might be able to give them some information? Like a lot of what we dealt with in outpatient is people who have repeated falls or falls again. Is there some suggestions that you have for people, especially for, people who I would say are 55 or 60 and up, where we see the higher risk of falls? What do you see in homes that could be easily fixed? Does that make sense?
Yeah. Definitely throw rugs or mats after surgery. Their walkers will get stuck on them and they will flip them up. And then I haven't had anybody fall because I make them take them up, but they're usually not up. Animals, surprisingly, golden retrievers and big dogs will knock people over after surgery. They don't think about that, especially when I come in. They get all excited and they run through the patient and try to knock them over. Bathtubs not being walk-in bathtubs, not being the right height to step over after surgery because they can't bend their knee or their hip or whatever. Grab bars in showers and in bathrooms, shower chairs. It's a lot of equipment stuff that people don't think about that they'll need.
Do you think that most people, I know you see a lot of joint replacements, both hips
Yeah.
and knees, but
Yeah.
is there something that people should say, hey, I'm going to need some help after surgery and I don't have a spouse, or what type of help do most of those people need?
Usually they can't get discharged home orthopedically unless they're at least like minimum assist or contact guard. So they need a little bit of help, but someone probably doesn't have to be around them 24/7. They might need help to get into the bath or something, but they can't soak their incision, but to get into the shower, and they can let the water run on them while sitting on a shower chair. But they don't need somebody constantly monitoring them if they're an orthopedic patient, like a hip replacement or something.
Gotcha. So if you have someone who's had one of those joint replacements, they need things like shower chairs. Obviously, they're going to need a gait assisted device.
Yep.
Most of the time, it's a walker.
Yep.
Is there anything else that is helpful at home?
I'm trying to think. Sometimes I'll recommend aerobic steps because people can't get in their bed and they didn't think about that. They
Oh, their
can't
bed
lift
is
their
too
legs.
high.
Yeah, and then they're stuck in their recliner chairs, which is another issue because the recliner chair rocks and they can't get out of it, and then they're just trapped. We had a lady that got stuck for like 8 hours because she did leave. Yeah, she couldn't get out. It was too low. So they need to think about the height of their surfaces like couches and chairs. And
So much easier to get out of a firm based,
yeah,
like kitchen type chair than anything, correct?
yeah, definitely.
Here, I'm sharing a comment with you. Sorcha is great. Saw me before I went to Cutting Edge.
Hi, hope you're doing well.
So we'll leave that up for a second here. I lost my train of thought. Isn't that crazy?
Surfaces, firm surfaces.
Yeah, firm surfaces and things like that. How long do most people stay with a home health therapist?
Oh gosh. So our orthopedic patients are usually 2 to 3 weeks, and then we will refer them to outpatient because they're past that really acute phase and they need a little more. Because we get them functional. You guys get them tuned up to where they need to be. We just get them out of the house. And then repeat what you said one more time.
Oh, I was just thinking about, you know, how long people stay with
That's it.
you. You know,
Okay. Yeah.
it varies a little bit.
Yeah, and then like if they have a stroke or neurological injuries like Parkinson's or diseases, that's a lot different. That could be months and months and months on end. Just depends on what they need.
And what are the qualifications to qualify for home care?
They have to be labeled or homebound is the main thing. They can't leave. Like they could think they're able to go to church, get their hair done, and a few other little things, but in order for the insurance to actually pay for it, they're supposed to stay home, and they have to have help with ADL or tasks of living, like showering and bathing and stuff like that. To some extent, just the extent is different.
Just as a reminder to all of our viewers, make sure if you have any comments, comment down below. And if you have a question for Sorcha, whether or not it's physical therapy related, home health related, or other, make sure that you put it in the comments below and we'll get those put up and we'll talk about them.
Yeah.
So you've worked an outpatient, you're
Mhm.
working in home health now. What kind of patients you like to see?
I like all my patients. You mean like type, like diagnosis?
Yeah, that's what I would say.
Oh yeah. I like ortho, but neuro is also interesting because it's always different. You can't really, it's not the same. Keeps it mixed up.
When you say
Um,
neuro, what does that mean to
oh,
patients, people?
like somebody who's had a stroke or somebody who's had a brain injury, Parkinson's, multiple sclerosis, stuff like that. They have different needs than somebody who had a joint replacement, usually.
Gotcha.
Yeah.
What are some of the difficult things in home health?
Uh, Paperwork. That's always really fun. That's from a PT standpoint, yes. For patients, it would be they can't always get someone there immediately when they need them because we may be I don't know, 2 counties away or something, and they're like, "Oh, I have this problem. What is it?" And I don't know. I'm not there yet. And then they have to wait. Same with medicine setup. That's always a struggle if they're out and if the doctor happens to not be in office or something. That sometimes that can be problematic. But
Gotcha. Okay, let's do a little transition here into a subject that both you and I have spoken about for several years now. Obviously, this country is having difficulty with higher education, and the difficulty is the fact that it's ridiculously expensive. I
yeah.
don't have the information right in front of me, but college has increased their tuition costs exponentially over the last 20 to 30 years. And one of the challenges is how do we pay for this? And obviously, student loans have become a real big problem. And I think a vast majority of us who have gone through professional school have had to take student loans. I'm going to give you my take on it in just a second, but when I went through school, it was essentially $15,000 a year. And that was in 1995, 1996, 1997. And I just signed the paperwork that they put in front of me. I didn't think twice about the fact that I was taking out $50,000 worth of student loans and what that was going to do to me later. Well, guess what? I found out what that was going to do to me later after 6 months of not having to pay. So why don't you give just a flavor of the experience that you had and some of the challenges that you have because of the student loans?
Well, it's almost like no matter what you do, you're in trouble if you want to be a PT, money wise, because I was salutatory. I had a 4.0, but I did everything I could to get the scholarships, and I got them. But I chose to go to Anderson, which is a private school, instead of like a public option. That's because I wanted to play sports. That's on me. But I was, low 20s. I wanted to do that. I like that. We were good. But yeah, it does add up. You don't pay attention to it. You're like, oh, I got scholarships. I'll be fine. But you sign that line and then you see it add up years later, especially after grad school, and you're like, whoa, it's like a house, it's a lot. And people don't know how much it impacts us because we pay on them all the time.
Sure. So if you look back and you had to give your 18-year-old self some experience, and because somebody's going to watch this video who's 18 years old.
Yeah.
And we have pushed really in the clinic to saying, hey, if you want to go to professional school, you need to think about how cheaply you can do this to get there.
Mm-hmm.
And so what kind of advice would you give to the 18-year-old who's about to sign the student loans, and what would you tell them?
I'd honestly tell them, especially if they're not going to like be an athlete, just do a public option. Nothing, I mean, some people have a stigma against going to like a community college. There's nothing wrong with it. It's the same, you're getting the same classes done. Um, it's cheaper. I mean, I would have done it if I didn't play sports. So I would say take that route. You can basically get a whole heck of a lot cut off that way. And then when you go to grad school, it depends on your options, but some are cheaper than others. You just have to take it into account and maybe save before you go. You got to do as much as you can in that aspect. Try for scholarships. It's a not a cheap program. That's why it's hard to do it.
Yeah. And one of the things that I've talked about with people who want to go into physical therapy is you should really find the cheapest option. You had the option to go a bunch of different places, and I hear it all the time. Hey, I can get into IUPUI, or I can get to IU, or I can get into University of Evansville. I said, well,
Yeah.
Why does it doesn't make any sense to pay $40,000 a year if you can only pay $15,000 a year? Because at
Yeah.
the end all be all, we just have a physical therapy license.
Mm-hmm. Yeah, I totally agree. I would have done that if I could change it. I mean, I met some of my best friends in my college years and stuff, but financially, it would have been smarter to do that. Yeah. And you're still going to meet people, even if you're in a smaller place.
Sure. And most people don't recognize that there's actually more student loan debt than there is credit card debt now.
Yeah. Yeah. It's a big problem.
Yeah. So there are some things being discussed in Congress now, anywhere from some loan forgiveness from, say, $10,000 up to $50,000. You know kind of where I'm at on this for the most part, but if there's somebody out there who doesn't know what that might do for the economy, what do you think it might do?
Honestly, I think it would help because I pay on mine, first of all. I pay extra on mine because the interest is frozen now too. So that's just
Which has been very helpful right now, right?
It's so helpful. If they would just keep the interest off, I think everybody would, it would be so much easier for people. But that's a whole nother issue. Anyway, what I think it would do is allow people that are my age, like upper 20s, mid 20s, they would feel more comfortable investing in like a home, you know, because they can actually pay for something and feel like they're getting somewhere instead of just throwing it out to Uncle Sam all the time because you're worried about the IRS down, you know, in your future and things like that. So I think you could put more into the economy if you had that extra X amount of dollars to buy stuff. That's my personal opinion, but I don't know what will happen.
Yeah, I mean, I don't know either, but obviously it's a big issue right now, and it really holds back a lot of people from doing a lot of different things, doesn't it?
Yeah. Oh, yeah. Absolutely.
Okay. So Christina says hello
Hi.
to you. Um, Going on about the student loans, I think there is a suggestion that, you know, hey, I paid all my loans off. Why can't you pay your loans off as well?
Yeah.
Yeah, we can. It's just going to take some time. Tell our viewers some extra things that you're doing to help yourself kind of really speed up that process. Now, I'll get to that in a second, but you know, the government reducing the interest to zero is significantly helpful. You know,
Mm-hmm.
because they're averaging 6 to 8% on these loans. It's not like, hey, we can get these refinanced to a 3% like they are with a house right now.
Mm-hmm.
So why don't you talk to me a little bit about that?
So things that I've been doing, like you said, the interest is frozen. So I've been working a lot at my full-time job. And then I actually, since August, I've been working, it's called a PRN job. So basically you kind of work when they need you or you have time. And that way I can put all that extra money right on them while the interest is frozen. So just constantly working, I guess. And then I've also been saving up cash to buy a car without getting like a big loan, you know, because I do want a nicer car at some point. So I've been doing that on the side.
That's great.
Mm-hmm.
Any other things that we didn't talk about that you think are important for us to know about the student loan? You know, I think personally that if we're going to start forgiving some portion of loans, then we have got to stop the program. The program didn't work. And it's been, and what people don't understand a lot of times, if you didn't take any loans, it's not like you walked into your bank and you got a home loan, you sign all these paperwork, you kind of know what you're doing. Student loan has been
Not like that.
described as predatory. Would you agree with that?
They don't really teach you anything. And I had a pretty good GPA. I mean, I'm not a dummy, but you're in college, everyone tells you that's what you have to do. You have to do this, you have to do that. Especially when your goal is professional school. And they're like, well, there's no other way around it. You know, we had to do it. And I don't like that mentality. Just because it's what's been done doesn't make it right. I mean, slavery was a thing, and that's not right. So, I mean,
yeah, that's my point with saying, if we're going to do some forgiveness, we have to talk about eliminating the program. I mean, it just doesn't make any sense to do that. And, you know, you can always come out of college and save money. You know, you can come out and get into the work field. And, you know, I just talked to a lady yesterday who was a high school teacher for 4 years and then went back to PT school. So, I mean, there are other options. But again, it goes back to saying, let's do the cheapest option. So, hey, what do you want to tell our listeners? Anything exciting? News coming up?
I don't think so. My boyfriend's coming this weekend, so
that's very exciting.
For me, it is. But other than that, no. But if anybody has questions, you can ask me or ask Jason, and we'll be more than willing to help.
So again, if you have any comments or questions, comment down below, and I'll actually put into the line here. But hey, I want to thank you for coming on. I know this is a challenge for you in the circumstance that you are, but it's been great to talk to you. And so if anybody needs to get in contact with you for home health, you work for Henry County Home Health, right?
Yeah.
Henry County Hospital. So obviously, if you need some home health services, you can certainly get them through her. There are some other options in the area as well, and there are therapists traveling all different places. But if you think a loved one needs home health therapy, how would they get in contact with some of those folks?
So if it's through our agency, they call our home care number, which I don't know it by heart, but you can Google it, and then they will, you know, talk about the services and if we can do an admission, if they apply. If it's other home care agencies, it's the same thing. I would just type it into Google, and there's several around here, but ours is pretty easy too. If you're a patient at the hospital, they will just set you up. So.
Gotcha. Yeah, that makes it pretty easy.
Yeah.
All right. So there's our last comment from Cindy. She loves Henry County Hospital. And we hear that over and over again about how great a job Henry County Hospital does. And especially in the orthopedics realm, I can't discuss anything other than the orthopedics realm, but they do a great job with it. So, hey, I want to thank you for joining us. It's been great to talk to you. You need to be safe and stay out of harm's way, and hopefully the weather will get better over the next couple of days.
I hope so. Everybody stay safe out there. Good talking to you.
Oh, wait. Hey, you need to see this last comment.
Okay. Oh, thank you. Love you.
All right. Hey, we'll talk to you soon. Be safe, and we'll take care.
Okay, bye.
Bye. All right. So that was our interview with Sorcha Cox. And again, keep commenting and liking and sharing the videos. Those are really helpful. And we'll see you back here in 1 hour for interview with Dr. Jeff Carter, who is the president of Bethany Seminary, but who has done some unbelievable world traveling. So we're going to talk about that, as well as his marathoning and his role and the role of PT in that. So we look forward to seeing you, and we'll see you in a little bit.